Today, BlueCross, BlueShield is announcing a program called Quality Blue, which is going to adopt the Bridges to Excellence process for recognizing physicians for quality improvement. Bridges to Excellence is a nationally recognized program designed to incentivize physicians for various ways of demonstrating that they've improved the quality of care they're delivering patients. So a physician or a group practice can submit information to Bridges to Excellence, and they can demonstrate to that organization that they are providing care that meets certain quality standards. When they do that, Bridges basically endorses them or says, you're doing a good job, and they get accredited by Bridges. There are 4 programs that we're going to be recognizing: diabetes care, chronic heart stroke, patient-centered medical home, which is a big agenda for the Quality Forum, and patient practice connections. So we're here at the forum because a lot of what we're doing is right in line with what they've been talking about, and we thought it was a perfect place to make the announcement.
We have, over the course of the past few years, really changed our business model. You know, I think the theme of today is change, change, change is abound, and obviously change is upon us. And I think if you'll go back a few years ago, you probably would expect that BlueCross used to go out, enroll an individual, give them an ID card, process a claim, answer a telephone, and that was and maybe issue a rate increase at the end of 12 months. And that was pretty much the cycle of the consumer engagement with the insurance industry. Well, times have changed. That's table stakes. That's behind us. Those are the things that we do every day that are just part of what's expected of us as an industry. The new expectation of us as an industry is to devote time on consumerism, help our individuals understand that personal accountability is also a large driver in healthcare costs. And we've done that through the creation of a program we started a couple of years ago, the 2-step program, Eat Right and Move More. And as a result of that, we're beginning to see more and more individuals get engaged by taking health risk assessments, by asking for information concerning their own personal health care. And we're seeing the results of that every day. Now, it's coming in drips. It's not actually gaining the momentum that we would like for it to have, but we are beginning to see individuals inquire about what opportunities they have to understand the challenges associated with their own personal condition and begin to take some proactive steps accordingly. The second thing we're doing, which is why we're here today, is to roll out our Blue Quality Initiative, and that is no longer do we look at opportunities to address quality, address efficiency. Those used to be things that when we finished our day's work, we would kind of get to. And now all of a sudden, those are the things that are of a priority nature at BlueCross, because we realize that in combination with a personal accountability system and a need for us to begin to share data and look for ways for us to influence the delivery model, those are going to be 2 very critical things that are going to emerge as we look for all the changes that'll abound on us as a result of healthcare reform.
For consumers, it means that in Louisiana, they'll now have sort of a nationally recognized seal of approval for a doctor who, say, does a really good job taking care of diabetics. A doctor who takes care of a lot of diabetics now can submit his results to this organization. That organization can endorse him with the seal, and our provider directories and actually health grades will show on their website that this doctor has received the accreditation. So I think it's just another way consumers can learn more about their physicians and learn who's doing what and who's working toward becoming better at what they do.